this year was how do traumatic brain injuries cause long-term cognitive and emotional impairments by disrupting normal brain function and neurochemical processes. How are advances in medical research and concussion management improving diagnosis, treatment, and prevention of long-lasting side effects? I wanted to start at the basics with what a concussion is. A concussion is a type of traumatic brain injury, or TBI. It's caused by a blow or jolt to the head. This force causes the brain to move rapidly within the skull, disrupting normal brain function and in severe cases causing bruising. This doesn't always pick up on brain scans. Concussions are labeled as mild brain injuries, however their effects are serious and can be long-lasting. Common symptoms include headaches, dizziness, confusion, memory problems, and sensitivity to light and noise, but the effects don't stop there. There are several serious neurological conditions associated with repeated and or poorly treated concussions. CTE, or chronic traumatic encephalopathy, is a degenerative brain disorder linked to repeated head injuries. It's when tau protein, which is a protein in your brain that helps break it down at a normal rate and rebuild it, builds up at alarming rates and causes your brain to essentially disintegrate in your head. This causes severe memory loss, loss of motor control, mood disorders, and in the end, dementia. Another condition is second impact syndrome, or SIS. This occurs when a person sustains a second concussion before their first concussion is fully healed. This is super common, but only in severe cases is it recognized and diagnosed because it leads to fatal and rapid swelling of the brain. PCS is the third one, or it's also known as post-concussion syndrome. This is when symptoms of a concussion like headaches, fatigue, difficulty concentrating, and mood problems like depression, anxiety, and irritability last for months or even years after a concussion. It's super common and often misdiagnosed for other mental health conditions. So what's actually going on in your brain during a concussion that causes these changes? Concussions are not single isolated injuries, they're cumulative. This means that with each additional concussion that you sustain, you increase your risk of long-term damage. The brain will also never fully heal from a single TBI. This causes long-lasting cognitive and emotional impairments such as memory loss, difficulty concentrating, depression, anxiety, and irritability, as well as changes in personality. This is due to what's called the complicated neurometabolic cascade that happens in your brain during and after a concussion, where the physical force of a concussion causes microscopic damage, a massive chemical imbalance, and a severe energy crisis within your body. Microscopic damage is most commonly seen as axonal stretching. This is when the actual acceleration and deceleration of the incident causes so much stress on your neurons, which is what holds your thoughts, feelings, emotions, and memories, and their axons, which is what transmits those feelings. It causes them to stretch, twist, and break. This is a good picture of it. So that's it, stretching and breaking at the top. Chemical imbalances take place in your brain through something called ionic flux. This is when there's so much physical stress on your cell membranes that they become weak and they can break. This leads to a flood of extra excitatory neurotransmitters, mainly glutamate. Glutamate in small amounts in your brain is essential for learning and memory. However, in large amounts, it kills neurons and can cause migraines. While this happens, there's also a chaotic shift in ions. While potassium rushes out of the cell and calcium and sodium rush in. Potassium in large amounts in your brain disrupts neuron signaling, which can lead to overexcited nerve cells, which can cause seizures or neural paralysis. Too much calcium in your brain is what causes the confusion and brain fog directly after a concussion, and then goes on to cause depression and irritability. All three of these can trigger neurotoxicity that can lead to cytotoxic edema or cell swelling. The neurotoxicity is also linked to Alzheimer's, but nothing directly points to Alzheimer's. The loss of energy that you experience during your concussion is due to lack of blood flow. The Runner's Academy notes that your blood pressure drops 20 to 50% after and during a concussion. Okay, understanding TBI or concussions today requires us looking at how our knowledge has evolved. In 1928, a pathologist named Harrison Martland first described a condition in boxers he named punch-drunk syndrome. These athletes were showing symptoms like slurred speech, poor coordination, and memory loss after a lifetime of repeated blows to the head. For decades, nowadays, this condition was only associated with boxers until 2002 when the neuropathologist named Bennett Amalu made a major breakthrough. He was studying the brain, an autopsy brain of a former NFL player, when he found evidence of what we now know as CTE. Dr. Amalus's research helped us to redefine the condition. It was the first step of bringing national attention to the dangers of repeated head injury. This is a good picture of a healthy brain compared to CTE. I just thought I would point that out. Amalus's work was initially super controversial, especially with professional sports organizations, but it ultimately led to a major shift in how concussions are understood and being taken more seriously today. This historical progression shows that what we once diminished as minor injuries are actually part of a much larger and more dangerous neurological issue. I got a question in my last TED Talk that kind of took me by surprise. Someone asked, why do concussions matter? To me, it was clear. I've had personal experience with a couple concussions, and now I've done a year worth of research on it. Concussions matter because they affect the most important organ in your body. Your brain plays a role in everything you do, from how you think and learn to how you feel, move, and make decisions. Even a mild injury can disrupt these functions in ways that aren't immediately visible. According to the CDC, about 2.9 million people experience a concussion annually in the U.S. alone. This shows just how large this issue is. The most concerning part about concussions, though, is your brain will never fully heal from a single TBI, hence why they're cumulative. Because our brains are responsible for who we are, our personality, our abilities, and our everyday function, protecting it is critical. That is why concussions should be taken seriously, no matter how minor they seem. Okay. Protocol advancements in sports are showing how effective research-based protocol can be, and how moving away from outdated protocols such as strict rest rather than active rest, which is the idea that someone with a concussion would sit in a dark, secluded room for 24 hours or up until their symptoms seem to go away. We've replaced this with active rest, which is when you start to slowly get back to your lifestyle. You're still talking to people, you're going on walks, you're doing a small amount of physical activity, and we found that it's way better in this time while your brain's healing for it to be slightly stimulated and then keep upping that as the days go. Another outdated protocol is waking up patients hourly. This was linked to the idea that falling asleep after a concussion is bad for your brain, and while fainting and falling asleep directly after a concussion can be more harmful than helpful for your brain, it's been found that sleeping 5 to 7 hours after the injury is way better, and you'll usually sleep for longer and sleep better. And then the 3-strike rule. This is mainly in sports, and it's the idea that you can only sustain 3 concussions in a season and you can't play for the rest of the season. This makes it seem like there's a quota to meet for concussions, and it makes athletes not want to come forward when they're injured because they want to continue to play. A major turning point in the NFL came with the case of Tua, I'm really bad at his name, I'm sorry, Tagovailoa, a quarterback for the Miami Dolphins. After suffering 2 concussions within a season, he sustained a 3rd. This caused him to lose consciousness on the field and have a fencing reaction. This is what he's doing right here. He's technically unconscious, but he's still kind of conscious, and people have this reaction when their spinal cord has been damaged, and it's something we see in underdeveloped adolescents is called a tonic neck flux. So when you push on someone's head and their arms go up, it shows that they're underdeveloped in their brain and their spinal cord isn't working with their brain and their body effectively, which is what he's doing here. He was removed for the remainder of the season due to the 3-strike rule, and the doctor who had been examining him was fired. The following week, the NFL released new, stricter guidelines, one of those being the rule on ataxia. Ataxia is impaired balance or coordination. Under this rule, any player exhibiting symptoms of ataxia may be removed for the remainder of the game. These changes are important because they prioritize player safety and reduce the risk of second impact syndrome. Okay. In addition to protocol changes, there have also been advancements in gear, mainly helmets. Modern helmet technologies such as MIPS, or multi-directional impact protection system, reduces the rotational force during impact using a non-friction layer that slides within the helmet. This is important because majority of concussions are due to rotational force. These helmets have been instilled in sports like skiing, mountain biking, snowboarding, and they're starting to be introduced into the NFL. Another helmet innovation is what I saw this one right here. It has a honeycomb-like structure within the helmet that helps to redirect and disperse direct impact. These are seen more in construction and military settings, and while helmets cannot prevent concussions, these innovations do help to reduce the severity of TBI. Okay. Despite these advancements, while I was researching, I still noticed some pretty large gaps. For example, all of this study that examined athletes with concussions and CTE studied large groups of men. This means we have limited knowledge on how concussions affect women specifically. The limited research that we do have suggests that women may be more likely to sustain a concussion and may experience more severe, longer-lasting symptoms. This could be due to differences in strength, especially in the neck, could be due to hormonal fluctuations and or differences in brain structure. Because females are so underrepresented, we don't know how the menstrual cycle is specifically affected by TBIs. However, we do know that hormones are affected by TBIs. Addressing these gaps is essential for developing more accurate diagnosis and more personalized treatment. Okay, so to answer my thesis question, traumatic brain injuries cause long-term cognitive and emotional impairments. They disrupt normal brain function and neurochemical processes. When the brain experiences repeated impacts, it damages neurons, altering chemical signaling, and can lead to inflammation over time. Without adequate care, this can result in conditions like CTE, as well as persistent memory, mood, and behavioral issues. However, advances in medical research and concussion management are making a significant impact on improved diagnostic tools, stricter concussion protocols, and better equipment. These are all helping to reduce the risk of long-term damage. Increased awareness has also made people more likely to recognize the symptoms and seek treatment earlier. At the same time, ongoing research, especially in underrepresented areas like females, will continue to improve our understanding of brain injuries. In conclusion, TBIs can have serious, long-lasting effects, but taking the right safety precautions, being aware of symptoms, and treating concussions as serious cumulative injuries rather than random bumps to the head are making long-term effects less severe and more manageable. And then I have my sources cited.